Okay, now the camera person was goofing off. I don't know what happened, but we dropped an alcohol pad. I just want you to realize that I'm going to take this alcohol pad, even though it's unopened, I'm getting rid of it to make sure I have a sterile environment. So I have this alcohol pad left, which I'm going to need. I'm going to get a brand new alcohol pad because I am conscientious. Any other doctor would probably go ahead and use that. I will not. I will not compromise the integrity of a patient. And by the way, the antibiotic we are using is dapamycin, which is a very powerful antibiotic. That's why there's so little of it administered. The patient must have their blood monitored and checked, or it could become toxic, which we depend on nurses to do that. Whether they do their job or not, I don't know. Don't care. Okay, now, if we could get the camera down here, it's been the proper amount of time. We're going to go ahead and administer the rest of the antibiotic, dapamycin. Dr. Dan is very good with big words. I am not quite so good. But I want you to watch the sterilizing procedure as we disconnect the patient from the antibiotic and we sterilize. And then we're going to go through a flushing, and then we will put a sterile cap on, and then the patient will be safe and sterile from any infection. So, I'm going to unscrew this very gently. I'm going to take an alcohol pad and open it in a very safe and sterile manner. As we get the alcohol pad out, we will apply the alcohol to here for 30 seconds. I know this might not seem like 30 seconds, but we're speeding the camera up. Okay, now that we've cleaned that, here's the important part. Now we're going to flush it. And after the flush will come the sterile cap again for this one that will go on and keep it sterile. Now this is very important. I know I worked with a Dr. Steve Toney. He's a gentleman that we've had to ban from putting on because these screw on like a bolt, and he tightens things like he's working on a railroad train. Now you can't do that. This is plastic threads. You do this gently. So what you do is you find the porthole, and the older you get, the worse your eyes get. It's bad, but I found the hole. It popped out. Sorry about that. But now this is something we can never train Dr. Steve Toney to do. But you gently thread it on there until it's snug. Now I will flush this port, put a sterile cap on this port, and the patient's procedure is done, and the patient is safe from all germs and infection. So I will gently push in, and even though I do get the air out of this, I prefer to not put all of it in so I don't get any air into the patient. But most importantly, like if you're a gentleman like Dr. Steve Toney, do not crank on this. It will strip the plastic threads, and I mean, we could have to take the port out and everything. I mean, it costs a lot of money. That's basically what it is. It comes down to money. So, okay, I'm going to put this in. It's just a steady push, just gently, all the way. And if you notice, I'll stop about 1/4 of an inch before it's there, so I don't get any air bubbles in. Now, since I didn't put it on like I was working on a railroad train, I can gently take this out. Once again, I will sterilize this. I'm very conscientious about germs. I am very sterile. Now, I've been training Dr. Lee, and I think he might have the ability to do this. Dr. Dan tends to talk too much and use big words that the patient can understand. And of course, we've went over Dr. Tony, who strips the threads out, and then we have to do surgery on the patient all over. So, we've got that. Now we have our sterile cap that we're removing the tab on. I can let that hang because it is sterile. I remove the cap. This is a sterile cap. As you can see, there is an alcohol swab in there. It's very sterile. As long as I don't touch it, and Dr. Steve, as long as I don't turn it too tight, everything will be fine. So now I insert it on the hole. There it is. I have gotten it. So as you see, we have flushed both lines. They are sterile, and that is the way the procedure should go. So we've just walked you through a procedure of flushing 2 ports and giving a patient a dose of dapamycin. So it's something that can be done if you're very careful and you're clear to sterilize and you don't try to tighten things like a gorilla. Bye-bye. Be sure to watch my next video where we will go through open heart surgery.